Good afternoon, Fresno Pacific students. Kinesiology 120, physical wellness. We'll be diving in today to see how God views your body, how you should be treating your body, and things that can affect you if you don't make that lifestyle change and work toward a better wellness. Okay, let's get started. Many people automatically associate the term wellness with the absence of physical disability. This is a misconception based on an oversimplification of physical wellness. It can also lead to some grave errors in the way we address the various aspects of our wellness. For example, it is not uncommon for us to consider ourselves physically well simply because we feel okay and are currently free of disease. The idea of feeling okay is subjective. We may say we feel okay and then add reinforcers like as long as I don't overdo it, or if I pace myself, or most days with exception of my heartburn, I feel just okay. Additionally, we may be engaging in behavior that is clearly recognized as risk factors for disease. So we may feel okay. However, it is quite possible that our performance in a variety of wellness assessment tests would indicate a very low level of fitness or poor physical fitness. We are personally responsible for how healthy and fit we are. Failure to do so can lead a lifelong battle with illness, disease, and giving you a quality of life that isn't favorable. No one else can do it for you. The responsibility relies solely on you. However, we can come up with all the excuses in the world to postpone a lifestyle change, but it solely rests on your shoulders. Physical wellness is more than just feeling okay. It's the ability to perform daily activities in a safe, capable, and efficient manner, as well as the physical capacity to respond effectively in unusual situations. Physically fit, physical wellness to do your job, whatever it is. Go to school, compete on a team. Being physically fit, physical wellness allows your body to perform at a high level, and that high level also affects you psychologically. Your mind is a better place if you're physically fit. Now, we all have our rationale of why we don't change our lifestyles, why we don't eat better, why we don't exercise more. We need to understand that we don't get out of shape in just one day. Okay, so that means we can't get back into shape in one day. You're not going to go turn around what you've done for the past how many years, months, whatever it may be, falling into bad habits, gaining weight, being out of shape, being unhealthy. It's going to take more than one day. Patience and being able to do it gradually. Get rid of the excuses. All right, excuses are only holding you back. Only you can make the change. Now, a lack of exercise and a lack of physical wellness can lead to chronic conditions, diseases that occur from a lack of physical activity. Examples of hypokinetic disease includes cardiovascular disease, type 2 diabetes, obesity, osteoporosis, high blood pressure, some cancers. All of this because you felt it easier to sit on the couch, watch TV, rather than to get on the treadmill or go for a walk, go for a run, go for a bike ride, swim some laps. Diseases can occur from your lack of physical activity. It's a circle. It's a circle of life. We'll call it the circle of poor physical fitness. No exercise, little to no activity leads to overweight and the accumulation of body weight, of fat, unwanted fat. Body weight is mainly composed of fat. It makes it harder for you to function. It puts more stress on your body, on your organs. Obesity can be a result of being overweight and not being active. You can develop diabetes and life-threatening diseases can develop that can lead to death. And we'll go over those diseases here shortly. One of those hypokinetic diseases is osteoporosis. It's a degenerative disease of the bones. You lose bone density, your bones become weak, and you don't even know that you are suffering from osteoporosis until you have a fracture. And this is due to poor nutrition, a lack of exercise, and vitamin deficiencies. Stroke. Stroke is a disruption of blood flow to the brain, often due to a blood clot. The arteries that lead to the brain are compromised and sometimes they burst. Atherosclerosis is a buildup of fats, cholesterol, and other substances in the artery walls. They become compact and they build and they create a blockage. High blood pressure, when the force of the blood against the artery walls is too high. Now, both of these heart diseases are a major cause of death in America and can lead to permanent mental or physical disability. All this depends on whether you get enough exercise and eat right. Some cancers also develop due to lack of physical wellness. Cells grow uncontrollably, robbing vital tissues and organs of necessary nutrients. Okay, smoking, your diet is a big factor in whether or not you can develop cancer. Exercise does provide some risk reduction. Being in better shape, your body is able and stronger to fight off this disease, at least slow it down. Okay, diabetes. Type 1, it's mostly genetic, cannot be prevented. Destroys pancreatic cells that release insulin. Type 1 diabetes is also called juvenile diabetes. It's a chronic condition which the pancreas produces little or no insulin. Type 1 usually appears in your adolescence. Symptoms include increased thirst, frequent urination, hunger, fatigue, and blurred vision. Treatment aims at maintaining normal blood sugar levels through regular monitoring, insulin therapy, diet, and exercise. So type 2 diabetes, the body either doesn't produce enough insulin or it resists insulin. Symptoms include increased thirst, frequent urination, hunger, fatigue, and blurred vision. In some cases, there may be no symptoms. Treatments include change of diet, exercise, some medication, and insulin therapy. Now, this type 2 diabetes is something that usually develops as you get older. Some things that affect lifestyle or hypokinetic disease. Some things that you can't change, like your heredity, your age, your gender. Those are some factors that you can't alter. Environmental, you're affected by the air you breathe, the water, noise, unsafe conditions. Sometimes socioeconomic plays a big part in whether or not you can make the change, whether you're able to have enough finances to buy fresh food, buy better food that's not all processed and quick and high in fat. Sometimes your job doesn't allow you to live the lifestyle towards physical wellness. And sometimes you're also affected by family issues like divorce or death. Those play a big part in stressors that kind of are a barrier from you making that lifestyle change. Some modifiable things that you can change, whether or not you smoke, how you eat, drinking alcohol, being inactive, and other risky behaviors such as drugs, hanging out with the wrong people. Those are some things that you can modify. A chronic disease. Chronic disease is any disease that lasts longer than 3 months. It generally cannot be prevented by vaccines or cured by medications, nor does the disease simply just appear. These are some things that are related to a chronic hypokinetic disease or just a chronic disease in general. Your diet and sedentary lifestyle leads to chronic disease. Some things that you can, a chronic disease is asthma, some cancers, type 2 diabetes, atherosclerosis, stroke, Alzheimer's, arthritis are all chronic diseases that are affected by your diet, your inactivity, and the choices that you make. Okay, now jump into physical wellness. Physical wellness is the ability to perform daily activities in a safe, capable, and efficient manner, as well as the physical capacity to respond effectively in unusual situations. It's an active process of becoming aware and making choices towards a healthy and fulfilling life. The goals of physical wellness should be to decrease the risk of disease and to increase overall function and efficiency through adequate exercise, proper nutrition, and abstaining from harmful habits such as drug and alcohol abuse and smoking cigarettes and vaping. But there's a common misconception that says, I'm not athletic. How can I gain physical wellness? Some people think, I surely am not physical well because I'm not athletic. Some people equate physical wellness with athletic skill. Athletic skill depends on specific training, like catching a ball, kicking a ball, hitting a ball, etc. Physical wellness is not skill focused, but rather it is health focused. It is more than just exercise. Physical activity is any form of movement that the body uses energy. It keeps your heart, your lungs, your circulatory system healthy. Just go for a brisk walk or swim some laps, ride your bike or go for a jog. Get your body moving and burn off that excess energy. Health-related fitness will not only make you feel better, it will also make you physically stronger and more capable of fighting off disease. Health-related fitness is our overall health. It's overall well-being. Performance-related fitness is more specific towards a certain sport, a certain activity. Public schools emphasize health-related fitness, where coaches emphasize more performance-related fitness. It's more specific to that sport. Cardiovascular fitness. 5 components of physical fitness. The first is cardiovascular fitness. Cardiovascular fitness is the ability of the heart and lungs to supply oxygen-rich blood to the working muscle tissues, and it includes the body's ability of muscles to produce energy for movement. Regular physical activity is one of the primary measures recommended for preventing the onset and reoccurrence of cardiovascular disease. To understand how regular physical activity can help, it's important to understand the basics of the cardiovascular system. The function of the system is to circulate blood throughout the body. As I mentioned before, the blood transports oxygen to muscles and organs, which require oxygen to function. Primary components of this system is the heart, the arteries, and the veins. The heart serves as the pump, and the veins and arteries serve as the pipeline for the delivery of blood. When blood comes to the heart, it is oxygen poor. A gaseous exchange has occurred in which oxygen has been removed from the blood and exchanged with carbon dioxide. The heart pumps the blood into the lungs, where carbon dioxide is discharged from the blood. The blood then picks up the oxygen to be circulated through the body, and arteries carry oxygenated blood from the heart to all the muscles and organs, while the veins carry oxygen-poor blood from the body back to the heart. Now, it can be assessed by a 3-minute step test to gauge your heart rate. This shows your endurance, your cardiovascular endurance, and shows you what shape your heart, your lungs, and the vascular system is in. The second component of physical wellness is body composition. Now, this compares the amount of fat to lean body mass. Many people mistake body weight with body composition. Body weight only considers the total body weight and not the makeup of that weight. Body composition addresses the makeup of the body to maintain a low level of body fat, regardless of the total body weight. People that only consider body weight completely miss the importance of percentage of body fat to good health and reduced risk for disease. Excuse me, it is quite possible to have what is an acceptable or low body weight and still have a dangerously high level of body fat. As the percentage of body fat increases, so does the risk for disease and injury. Furthermore, as the percentage of body fat increases, the percentage of lean muscle mass decreases, which causes decreased efficiency in movement, which leads to less exercise, primarily because it's difficult and painful to move and be active. The percentage of fat can continue to increase, rising to extremely dangerous levels. It can become a vicious cycle: inactivity, increased body fat, increased risk for disease. Unless you are involved in regular physical activity, you cannot address the other component of health-related fitness. Your risk for lifestyle disease skyrockets. Improved body composition allows for more efficient movement and a better quality of life, along with the reduced risk for lifestyle-related diseases. Now, a way to measure your body composition is the BMI. This is more usable for the regular person. Athletes, it's not so much. It determines what's body fat, and then it also goes to the lean tissue, the muscle, and the body organs. It takes that into consideration. Muscle strength, the third composition of physical wellness. Muscle strength is the ability of a muscle or muscle group to exert a maximal amount of force at a single time. An example would be an Olympic weightlifter using all his energy to lift an incredible amount of weight in a single effort. Muscular endurance. Now, muscular endurance is the ability of a muscle or muscle group to repeatedly exert a given force. An example of muscular endurance would be a worker that lifts multiple items multiple times per day, like a delivery man or somebody that works in a warehouse or a mechanic that installs new tires daily. Muscle endurance, the ability of muscles or a muscle group to generate force over a prolonged period of time. Flexibility. Flexibility is very important in helping you perform your daily physical activities safely, effectively, and efficiently. Regular flexibility exercises improve and maintain joint mobility and range of motion. Keeping your hamstrings stretched and loose, for example, can help relieve lower back pain. Tight hamstrings become shortened and weak, putting unwarranted pressure on the pelvic region, creating debilitating pain throughout your lower back. Now, it's largely affected by muscle tissue elasticity and temperature, meaning the more you get the blood flowing and your body temperature increases, the muscles loosen up and are more apt to lengthen, taking less stress off of a joint. So keeping yourself and having good flexibility is vital to any wellness program. A person involved in a regular physical activity that addresses cardiovascular fitness, muscle strength, muscular endurance, body composition, and flexibility increases the overall capability and reduces the risk for lifestyle disease, which in turn leads to a better quality of life. Now, performance-related fitness. We kind of touched on it before with the talking about performance wellness initiative. Performance-related fitness involves skills that will enhance one's performance in athletics or a sporting event. Speed is the ability to move your body swiftly. Agility is the ability to change direction and control the body while maintaining a rapid motion. Power is the ability to move the body parts swiftly while applying maximum force of the muscles. It's a combination of speed and muscular strength. So power is the ability to move while applying maximum force of the muscles. It includes speed and muscular strength. Balance is the ability to control or stabilize the body when one is standing still or moving. Coordination is the ability to use the senses together with body parts while moving. Reaction time is the ability to reach or respond quickly to what you see, hear, and feel. Speed, once again, is the ability to move swiftly. Agility is the ability to make changes in direction. Power is being able to utilize speed and muscular strength. Balance is where you control or stabilize your body. Coordination is being able to utilize your senses together with body parts. And reaction time is the ability to respond quickly to what you see, hear, or feel. The FIT principle, or the FIT formula, is a great way of monitoring your exercise program. The acronym FIT outlines the key components or training guidelines for an effective exercise program. F stands for frequency, or how often you exercise. I stands for intensity, which is how hard you exercise. The first T stands for time, or how long you exercise during each session. And the last T stands for type, or the type of exercise that you do, whether it be running, aerobic, or anaerobic, which we'll be touching on shortly. One important thing to remember is the direct correlation between the number of calories you expend and the number, intensity, and duration of exercise sessions in which you participate. The principles of physical activity. Upon realizing the benefits of regular physical activity, you may be ready to make some lifestyle changes. When people begin training and participating in regular physical activity, they will experience a condition known as the training effect. The training effect is the actual physiological changes that begin to occur as a result of regular physical activity. It measures the impact of an activity on your aerobic fitness. As the activity progresses, the training effect value increases, telling you how the activity has improved your fitness. Examples of changes include a decreased resting heart rate, lower blood pressure, increased cardiac capacity and function, and changes in body composition. To safely achieve the training effect, you need to utilize multiple workout sessions per week. Normally, you would begin with aerobic activity 3 times per week at 30 minutes per session. Principles of training. The overload principle. For physical improvement or adaptation to occur, physical activity must be performed at a level that is greater than normal, or an overload. The overload can come in for the form of increased frequency, intensity, or duration, or a combination of all three. Increased frequency, intensity, or duration, or a combination of all three. Typically, you would only increase 1 or 2 of the 3. Including all 3 can lead to injuries. So you don't want to push yourself too far to the point where you do something that you can't handle and you injure yourself. You need to increase the overload slowly and methodically, not trying to make everything done, get everything done in one day. Progression. When an individual regularly and consistently participates in a workout program, physiological changes begin to take place as a result of overload and adaptivity. The body adapts to the increased physical workload of the exercise program. You realize that you can complete the usual workout faster, or you can do more work at the same intensity level. Your body adapts, and you learn that you increase the duration, intensity, and or frequency. You're seeing results. Things are becoming easier for you. Your regular workout is becoming easier. You're able to go longer at a higher level of fitness, intensity, higher intensity of your workout. The safest way to increase performance is to combine both overload and progression principles. Determine your physical activity goals. Compare your goals to your current capabilities and consider a time frame for reaching those goals. Know your limits. Be conservative and systematic. Determine where you are at and where you want to be. Be gradual. Avoid overloading the elements of fit. Avoid increases in frequency, intensity, and duration that are greater than 10% of your current levels. Once you achieve your goal, you will have to readjust your goals for further improvement. So as you see the results, you can increase the intensity and the overload as you progress. But be gradual and try not to do things too fast, too soon, or you'll have a risk of injury. Specificity. Specificity is exercising a specific body part or group. You work on developing specific areas of weakness. Like you see in the picture here, the basketball player is squatting, working on his lower body to help his jump shot. The power of the jump shot comes from the legs, from the hips, and doing that squat works out that body group, the lower body group, the hips, the legs, and creates that muscular strength to help in that jump shot. Now, this includes sport-specific skills. Like I said, a swimmer swims, a runner will run. What you're doing is for a specific task, for a specific sport. It's done for something that you're going to do in a competition, something that you'll do on a daily basis, specific to that task. Principles of reversibility. Reversibility is losing improvements once the training has stopped. Once you stop your exercise program, the principle states the obvious. You may or will revert back to your original body condition. The effects that you achieved will gradually fade away. So if you stop your normal routine, your program, your effects that you've gained, that you've worked so hard for, will diminish over time. And then you're going to revert back to the pre-training condition, and sometimes worse. So it's important to be consistent and keep up with your program, assessing it as you gain strength, as you improve, as you get stronger, reestablish new goals, and don't quit. Don't stop your lifestyle change. Now, we're all different. Okay, so that meaning we're unique. All right, God made us unique. So we're going to all respond differently to different exercise programs. When considering an exercise program, you need to tailor it to your needs, to your capabilities, to what you want to accomplish. You know, it all depends on body size and shape, physique, the shape that you're in. Genetic history, maybe you've got some barriers that won't allow you to do a lot of aerobic exercise. There's some lung issues. Past experiences you can go by. You know, how did things work out before? What didn't work? What did work? Chronic conditions. Maybe you've got arthritis and the body is not able to do what it used to do. Maybe you're injured. Genders, males tend to be bigger, stronger, so they're able to work on muscular endurance and muscular strength, and their heart, lungs, the systems that allow them to work harder, longer, and get a little bit better results. Training intensity is how hard you train to obtain maximum performance. You can determine this through your heart rate. Maximum heart rate is 220 minus your age. That is going to be your maximum heart rate. Okay, and then to maintain while you're training, to maintain target heart range, the beginning stage is 60% of that max heart rate. And as you get stronger and further into your exercise program, that'll increase to work to get to 80% of that max heart rate. Aerobic and anaerobic exercise. Aerobic means with oxygen. It's any activity that utilizes the large muscle groups and is performed at a submaximal intensity and can be maintained for a sustained period. Examples would be dance, stair-stepping, jogging, walking, running, swimming, and cycling are all examples of aerobic activity. Anaerobic, without oxygen. It's any activity that utilizes the large muscle groups and is performed at maximal or near maximal intensity for short periods of time. So aerobic was for longer periods of time, and anaerobic was for short periods of time. Examples include sprinting, lifting weights, and interval training. Resistance training. Isotonic contractions. And we'll just go take back. Resistance training involves contracting muscles or muscle groups against some type of resistance. The resistance can be a movable object or an immovable object. It can involve contracting against the force of another muscle group or muscle, and the result is the improvement of muscular strength and endurance. Isotonic contractions is a contraction in which the resistance is a movable object and the muscle or muscle group changes length. Examples with these would be free weights, a resistance band, weight machines, walking, or running. Isokinetic contractions is a contraction in which the intensity, the angle of the contraction, and the rate of the contraction are constant. And it comes from a movable object. The rate of contraction, intensity of resistance, and the angle of contraction are controlled by a piece of exercise equipment. A stationary bike, a treadmill, stair climber, universal machines are all examples of isokinetic contractions. Isometric contractions is a contraction in which the muscle or muscle group does not change length and the object or resistance is immovable. An example would be to stand in a door frame and press your hands against either side of the door frame, or a wall, or the floor. The resistance does not move and the muscle does not change length. Rate of perceived exertion, RPE. It's a common tool used to assess training intensity in individuals as well as some teams. RPE values give a reference point for an individual's internal load, which can be compared with others during a similar session. When you start your workout, it's important to prepare your body for exercise. And within that RPE, one way to assess it is the talk test. If you can hold a conversation and you're exerting maximal or submaximal effort, the way to assess it is by, are you able to have a conversation with your neighbor? Are you able to talk? When you're taking a walk, you're walking briskly, are you able to hold a conversation? That's how you would assess your RPE. And how you're feeling is a fairly good estimate of what that is. Principles applied to training. From a health perspective, moderate exercise provides the best benefits. 3 to 4 times per week, 30 minutes a time, 60 minutes worked. Start out gradually, start out slower, and then gradually build up and get stronger. You can add intensity, you can add duration to your training. Now, if you just do low intensity, that's going to require more time, and you're not going to see the results as fast. Break up the training time into multiple day sessions. Space it out. You're going to do muscular strength one day, then you're going to work on your aerobic exercise and work on trying to build up your ability to train longer and harder during your sessions. And within that, make sure that you're including flexibility. And when you're starting out, exercise the large muscles first and then smaller. Flexibility exercises that you need to include, don't include those as a warm-up. Perform that before and after exercising, a warm-up and a cool-down. A warm-up minimizes injury. Warming up correctly gradually revs up your cardiovascular system by raising your body temperature and increases the blood flow to your muscles. And a proper cool down allows for a gradual recovery to your pre-exercise heart rate and blood pressure. Benefits of physical wellness. These are pretty obvious. Controls your weight, controls or combats health issues and disease. It fights against those diseases. You're maybe not gonna not get a chronic disease or a disease, but you're gonna be stronger and be able to fight it off and slow it down. Mood's gonna be improved. You're gonna be happier. You're gonna have a boost of energy to be more productive during the day. You're gonna sleep better, and you're gonna look better, which is gonna make you feel better, if not just physically, but also mentally. So the 5 components of physical fitness is the cardiovascular system, your lungs, your heart, your arteries, your veins, pumping the blood through the body, getting it to the muscles to be able to work. Muscular strength, muscular endurance, your body composition of your fat to your lean muscle tissue. And then flexibility. Flexibility is very important for your health, to keep your joints able to move. Your muscles will be not so tight, and you're going to be able to work better, feel better, and have a better quality of life. So that's physical wellness. Thank you, and we'll be talking to you again soon.